Welcome to Equal Ground Headlines. I am Samuel B. Williams, bringing you balanced coverage on our top stories of the day. Kainio Westolbase, Kinsevions. And now, an update on healthcare regulation. If you're getting value from these analyses, please like this video and subscribe to our channel. It really makes a difference. On to the story. A federal judge in Texas has struck down a Biden administration rule that would have required higher staffing levels at nursing homes. The ruling, handed down by U.S. District Judge Matthew Kacsmaryk, is a major win for the nursing home industry, which had fiercely opposed the staffing mandates. It also highlights the ongoing tug-of-war between efforts to improve care for seniors and the business realities of elder care facilities. Let's unpack what the now-blocked rule would have done. Issued last year under President Biden, the regulation set nationwide minimum staffing requirements for nursing homes that receive federal funding, Medicare or Medicaid. Specifically, it would have mandated around-the-clock RN coverage. Every facility would need a registered nurse on duty, 24 hours a day, 7 days a week. Current federal law only requires an RN on site 8 hours per day. Increased care hours. Homes would have to provide at least 3.5 hours of nursing care per resident per day, including care from nurse aides. Existing law is vaguer, saying staffing should be sufficient to meet residents' needs, which often translates to lower staffing levels in practice. These standards were intended to ensure that elderly residents receive adequate attention and skilled care. The backdrop is well known. During the COVID-19 pandemic, tragic stories emerged of understaffed nursing homes where residents didn't get basic care. Biden's team responded by formulating what would have been the first ever nationwide staffing minimums for nursing homes, arguing that thousands of vulnerable seniors suffer neglect due to insufficient staff. However, nursing home operators warned that these requirements were unrealistic and potentially devastating for their facilities. They said there simply aren't enough nurses and aides out there to hire. The industry faces chronic workforce shortages, and that the rule would force many homes to either operate at a loss or shut down if they couldn't meet the staffing mandate. Industry groups, led by the American Healthcare Association, AHCA, sued to stop the rule, and now they've prevailed in court. Judge Kacsmaryk's ruling was pretty blunt. He found that the Department of Health and Human Services, HHS, exceeded its authority in imposing these staffing levels. Essentially, he said Congress never explicitly gave HHS permission to mandate specific staffing ratios in nursing homes, so doing so was an overreach. He granted summary judgment to the plaintiffs, the nursing home groups, meaning the case didn't even proceed to a full trial. He believed the legal issues were clear enough to decide now. In the decision, the judge noted that federal law on nursing home staffing is relatively minimal. It requires an RN for 8 hours a day and sufficient overall staff to meet residents' needs. The Biden rule tried to interpret sufficient in a concrete way: 3.5 hours per resident, 24/7 RN. But Kacsmaryk wrote that this went beyond what the statute allows. If Congress intended to set specific hours, it would have done so in the law. By setting its own numbers, the agency ventured into legislative territory. The nursing home industry is celebrating the outcome. ACA's president, Cliff Porter, called the ruling a victory for our nation's seniors and their families. From their perspective, the onerous staffing mandate is off the table, averting a crisis where many nursing homes might have closed or stopped taking new patients. Industry reps have long argued that forcing high staffing levels sounds good, but would actually backfire by causing shortages of care. If homes shut down, residents would be displaced and have nowhere to go, especially in rural areas. Porter's statement said the Biden rule was unrealistic and that it threatened to close nursing homes and displace vulnerable seniors. Indeed, smaller or financially weaker facilities were bracing for hard choices. Some might have had to limit occupancy or cut other services to afford more staff. So for operators, this court ruling is a relief that allows them to continue business as usual, at least for now. On the other side, elder care advocates and patient families are disheartened. They argue that low staffing is at the root of many nursing home tragedies, from residents left in soiled beds for hours to missed medications to unnoticed health declines. They believe higher staffing standards are absolutely necessary to ensure safe and dignified care. The court's decision, in their view, is a legal technicality that comes at the expense of seniors' well-being. Though rooted in laudable goals, the final rule still must be consistent with the law, the judge wrote, acknowledging the good intentions, but striking it down nonetheless. It's also notable that the case reveals some internal dynamics of the Trump administration. The head of CMS, the agency under HHS that oversees Medicare/Medicaid, is now Mehmet Oz. Yes, the celebrity doctor who was appointed by Trump and confirmed by the Senate. During his confirmation hearing, Dr. Oz had hinted he might be open to softening the staffing mandate. However, since taking office, the administration had actually continued to defend the rule in court, perhaps out of obligation, since it was still on the books. Now that the court has voided it, the Trump administration doesn't have to make the politically fraught choice of whether to enforce or repeal the rule themselves. The judge did the heavy lifting. What happens next? The Biden-era rule is effectively dead, unless the government appeals and wins a higher court ruling. The Justice Department could appeal to the Fifth Circuit, but given this administration's stance, it's unclear if they will. They may be content with the outcome. If there's no appeal, or if appeals fail, any future attempt to impose staffing ratios would likely require an act of Congress. That seems unlikely in the current political climate. In practical terms, nursing homes will continue operating under existing federal and state staffing rules. Some states have their own requirements. For example, California mandates certain staff-to-patient ratios. But in states without strict rules, homes will not be forced to add staff beyond what they were doing. Critics fear this means the chronic understaffing status quo continues. Nurses and aides stretched thin, high turnover, and residents not getting enough attention. This legal battle also underscores a philosophical divide. Should we treat nursing homes more like hospitals with firm standards, or allow more flexibility due to cost? The Biden administration clearly leaned toward treating them like medical facilities, requiring minimum standards. The industry And now the courts lean toward acknowledging the cost and labor realities of long-term care. For families with loved ones in nursing homes, the news is mixed. On one hand, they won't face potential upheaval of facilities closing, which could have happened if the rule went into effect and some homes failed to comply. On the other hand, they also want to see an influx of new hires at the nursing home taking care of mom or dad. The care they get will remain dependent on how each facility manages staffing under current guidelines. It puts the onus back on individual homes and on vigilant families and state inspectors to ensure residents are cared for properly, rather than a blanket federal solution. In summary, a judge has invalidated the federal government's attempt to mandate minimum staffing in nursing homes, saying the agency overstepped its authority. The nursing home industry is breathing a sigh of relief. While patient advocates are concerned this leaves seniors in jeopardy. The classic debate of regulation versus feasibility. And for now, feasibility won out. The focus now shifts to what alternative steps, if any, will be taken to address nursing home care quality in the absence of this rule.